we condemn this incident in the strongest possible terms. I think it leaves us with a bitter taste, given that as healthcare workers, our primary focus is to respond to emergencies and to be able to provide care to communities, and to have to now find ourselves in a space where we have to then worry about our safety. Really, it's something that we would not like to find ourselves in. We have obviously put in a number of interventions from the point of view of creating a much safer environment. All our vehicles now are installed with cameras. We've got also tracking systems. That's why in this incident we were able to immediately, when the colleagues pressed the panic button, we were able to pick up as to where they were, and we fortunately have footage of the perpetrators, and that has been handed over to the police. We hope that this is going to assist in speeding up the case, because they've got the footage, they've done the fingerprinting, so they know who the perpetrators are based on the footage that they've been provided with. Part of the other measures that has been introduced in Gauteng is that there is a program now to roll out the Gauteng panic button, which is obviously going to be given to health workers and all other workers that find themselves in vulnerable spaces to be able to use. Our sister department, e-government, is responsible for that program. They've started now with phase 1 of rolling it out to some of the health workers, so that they can then see how the system works, and eventually it will then be rolled out throughout the entire province. But we also have other measures, including us engaging with community policing forums, engaging with the SAPS as well, to work with us, so that in areas where we know that we are vulnerable for attacks, we're able to have escorts that can escort our emergency medical personnel. We know that the attacks are not just targeting ambulances and paramedics, but also other healthcare workers. They also face attacks when they go to communities to do work. I mean, recently we had an incident in Bronkhorstspruit where some of our health workers were actually robbed of their belongings, and we are appealing to the community to say, work with us, work with the police, to ensure that we safeguard our healthcare workers, and we are able to provide relevant information where this kind of incidents do take place. From the point of view of government, we are obviously increasing measures that are put in place to ensure the safety of our healthcare workers.